Hello. It's me, Sylvie, once again. I am presenting today on how to choose the right explant surgeon. I would love to educate to any woman or any man out there that would love to help their significant other on how to find the right surgeon. So these videos I'm making basically out of love, and I would love to help at least one person. That's my goal. Every time I present, I want to just help one person. Besides spreading knowledge, I believe knowledge is power. Besides trying to guide somebody, I think that is just my goal of making all these different channels and try to connect with the community. I think this is a great tool. So hopefully you get something from this presentation and help you in any way. All right, let's get rolling. All right, so the outline of this presentation is basically in different questions, different topics on when and where and who and why and how. So it kind of help you to kind of guide you to how I and what it made me to decide of the this plastic surgeon that I found. So here we go. So a little intro. Just know that my name is Sylvie. My first name is Savannah. They call me Sylvie just to make it easier because my name can be pretty much messed up all the time. So Sylvie is good to me. I'm a registered nurse and with a lot of experience, and especially in trauma neuro rehabilitation. I have seen a lot of patients with recuperating for a stroke and help them to reach their maximum potential, uh, to get home and to their loved ones. So I also have been actually a lead preceptor in nursing, and pretty much I have trained a lot of students for different schools and LPNs, registered nurses from different universities. I love teaching. Hands down is my favorite sport. I guess it should be a sport, right? Teaching. So, and I love to also share tips on holistic wellness. I'm very enthusiastic in that area. I wish I had that mindset when I put these implants in, but let's not think about the past, right? Let's think about forward ahead of you. I'm also a new grad of mental health nurse practitioner, and I would love to help those new grads coming out of school. And I'm sure how you may feel, like which turn should I turn, which job should I take, or all that. I would love to help out down the road for sure, and also for nurses, new grads coming out of school, and also the ones that are interested in the field. All right, let's continue. Topic one. All right. Um, like I said, I'm not editing of this videos. Forgive me if I'm making any mistakes. All right. When did I decide to look for plastic surgery? At what time and when and what year? So it's approximately think like around 7.5 to 8 year mark after having breast implants is when I had collected all the symptoms, which I was really miserable to the point where I would cry all the time. Think of people may think like, what's wrong with me? My mother was looking at me like, okay, are you okay? All right. So after going over the different labs, after going over different tests and figured out what is happening with me, because keep in mind, I was and still I am after the fact I've been through all these hurdles with my health. But I have to say, I'm always been like a very healthy in a way. Like I'd say, like conscious. I would exercise 3 to 4 or 5 times a week. I was very active person. So around 7.5 to 8 year mark is when I started to kind of having more of a research that I collected through the time, and I really did realize my intuition was telling me all along, it this is just not me. I mean, the person that has suffered this BI symptoms, you are the one that will know what's wrong with your body. You're the one that will know there's something off here. Any doctor can actually do the part of trying to test different areas, give you all the different type of lab work, and try to narrow it down to the root cause of the problem. But at the end of the day, you are the one that's going to guide any practitioner on what the problem is. So I always say, follow your gut. Follow your gut. All right, so yeah, so around 7.5, 8 year mark is when I started, when I found my started looking for a plastic surgeon. All right, so where did you find your expert surgeon? So I always say to everybody, knowledge is power. Knowledge is where it's going to take you, which route should you take. I believe research is really valuable, especially the evidence-based practice research that has been proven in clinical practice, research that has been proven on effective treatments, results from a patient. I mean, things that are collected through the time. I would suggest to look into peer-reviewed journals that are done by doctors and researchers and scientists. And that's the reason the information is out there, for reasons for you to learn from that and to take it serious. So after knowing the fact that I was suffering from breast implants, after doing my own research and following my gut, I continued to kind of guide me where I need to find a plastic surgeon, because I can just close my eyes and pick a surgeon out of a list. I would say that would be a no-no from my side. I'm just letting you know my opinion, and I'm trying to guide you to the right path. So I would say that, interesting enough, and probably people may disagree, may disagree or not disagree. I do believe that social media can take it two different routes, either very negative or can be really positive. I always try to do things in a more positive way. I always try to kind of direct my life in a more positive, holistic way. I don't know how to put it in words, but this is the way I think of social media. Social media is a really powerful tool nowadays, especially for mental health right now, as far as maybe people may find some kind of relief of finding somebody that has the same type of symptoms and may share the same type of story. I think it's a really valuable tool. It all is up to you how you take social media. You have to remember that social media can be really toxic, but I would love to make an outlet here and a line of communication to all of you to really talk to you as like I'm talking to my friend. So I would love to say that social media, it really was another plus on the search of my explant surgeon. Besides the research, I did find through Instagram. Out of all the places, I did find through Instagram. So it was an account that I had for a very long time, just for family and friends. And I ended up coming across a post from Claire, the bachelorette, and she was just discussing about her rashes, specifically her rashes, and how her life was just pretty much placed upside down. I mean, I really was listening to her story, and I was just like, oh my God, that's exactly my story. That's exactly what my rashes look like. That's exactly what I was feeling this whole time. So it kind of helped me narrow it down, like, this is the problem I had all this time. So I continued with that research, and I did find out that her surgeon that she picked, it was from Aqua Plastic Surgery. So that is the place where I found my surgeon. And here he is. He is the main person of this PowerPoint. This is the angel that pretty much came across and my research, and I did narrow it down to him. I'm wondering what is so special about this person? What is so special about this human? All right, so where do I begin? This is Dr. Dev Vibakar, and he is absolutely hands down the greatest person. He's a board certified plastic surgeon. He's based in Brickell, Miami. He started at a practice also named Aqua Plastic Surgery, and based in, I believe, Jupiter, when I found out last time. And he was working along with other surgeon, and that's how I ended up finding him, and knowing that he was kind of near me, and I thought, oh, let me dig in more about him, right? Let me find out more information. So it's just kind of it was just really organic the way that it just led me to him. So here is, you may think, where did I put this here? This is actually a great way to find reviews from patients that actually has had procedures through him. So I would definitely consider. So anytime you may think, okay, how did you find him? Why did you pick him? I always suggest to anybody, to even man or woman or whoever, to always double check that the person is a board certified plastic surgeon. This case, this wonderful man, he's a doctor. He specializes in plastic and reconstructive surgeon. He's a founder, medical doctor, director in aquaplastic surgery in Miami. Like I said, it was based in Brickell, Miami. So he specializes in breast implant removal surgery. And that is one thing I want to say loud and clear. The one thing that I definitely suggest to all women looking for any plastic surgeon that you pick, that this person definitely has the mindset on just explanting. You understand and hear me? Is explanting, not putting them in. So once you know that the plastic surgeon only does explant, that's definitely a bonus. I would say so. That's just my opinion. Anyone has their own opinion. At the end, you're the one that's going to choose it, right? So the part that really helped me narrate to this doctor is that he specializes only in breast implant removal, and also believes in breast implant illness symptoms, which he's totally devoted his time on that particular area. That to me, it's just beautiful. And it was a plus in my list. Like I said, he's a board certification by accredited governing bodies. So when you find your plastic surgeon, you make sure he's board certified. Okay, that's definitely something that you have to always keep in mind. He's board certified. So just also understand that any plastic surgeons, you can check their information through the American Board of Plastic Surgery, like American Society of Plastic Surgeons. This is like an organization that they have, like basically overseas members. The members that are on board, that they have all the resources to help you, and basically they check the physician's credentials. So it's very, very important that you do your research. It's something that you must do. I mean, I imagine some people may go with just the reviews and that's it. That will be it. No, I would definitely suggest you to really do dig into the information. If the information's out there, it's for a reason. You understand? It's for a reason. All right. You may say, why board certification? Why is so much of a deal? Why it's such a big deal? Okay, you got to understand that board certification also shows like what kind of surgeon this person is, right? What this surgeon has taken as far as additional steps to able to perform cosmetic, surgery safely and also ethically. That's really important. So you have to understand also that shows you like how much they have done as far as additional residency, additional practice, additional extra practice, right? And they all shows you, like it will show you too, like how committed they are to upholding any safety and ethical standards as part of their certification. It's just super, 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 super important. I do believe wholeheartedly that residencies, for example, fellowships for any type of health professionals, is really wonderful foundation. I personally have been in one. As soon as I graduated for nursing, I did go to a residency from a magnet hospital, which was very, very incredible experience. And obviously, I'm not comparing my experience to a doctor. I'm not saying that. I'm just saying the foundation for any health practitioner, especially a surgeon. It's very, very, very good. Something a positive, right? So after finding out that your plastic surgeon is actually board certified, you also have to look at the type of experience this surgeon has, and also the results, right? The positive outcomes from patients, any testimonies that they're able to share, the positive ratings, but also the positive ratings from previous patients, and the type of medical staff. I believe the medical staff, the surgeon is one thing, but the medical staff is actually what makes the surgeon's practice even better and stronger. I think it's a positive. It's basically the medical staff is what represent the surgeon. So that is something that you really have to dig in, really double check. How is the medical staff? How is everyone responding to any type of emergency and things like that? You can follow. You can join any groups that plastic surgeons nowadays have, like Dr. Dev Viva Car's support group in Facebook, for example, is one area that I found out like straight from their mouth, patients' experience. I think is most valuable tool. I can tell you from my own experience, because actually I've been on the other side as a patient, so I can tell you sincerely how my experience has been. One thing I want to let you know, this video is not something that I'm getting money on the side. I'm not promoting anybody's practice. I'm not saying, I was not told by anybody, oh, do this and I'll pay you something under the table. I'm doing this out of my heart. I'm doing this because I love educating and I love to help you of kind of guide you and navigate the areas of how to help you narrow down to your surgeon. So this is exactly what I chose, and this I am so happy that I did. So at the end of the day, you will have your own selection. You're the one that's going to choose what's best for you. And also let you know that, like I said, you can search more in American Society of Plastic Surgeons. And also this is a LinkedIn that he's on and you can look into more. But I would love to let you know, any surgeons you choose, you have to do your research, write down the list of what certifications they have, what experience they have, how many ratings they have, and things like that. Also, just keep in mind that this doctor has definitely great positive reviews. Like I told you earlier on Real Self right here, incredible reviews. It's something that it comes from a patient, and actually I put my review there too. Also, he's been on a U.S. News and World Report, which is really, really impressive. So just something that I think it's through the research I've done, it's definitely a plus plus. Also, think that I would like to share that his education is really impressive too. Also, look into that person's education, the plastic surgeon's education, and he's been actually studying at Harvard Medical School. He has focused on adult facial reconstructive surgery and aesthetics. He's really specialized in microsurgery. Like, it's really, really impressive. It's just overall amazing. Overall amazing. So by just saying all that, I mean, that's the reason why I chose Dr. Devi Vakar. He's level 4 certified plastic and reconstructive surgeon. He has all this experience here and under his belt. Is incredible. He is, I solely picked this surgeon because he truly believes in the BI symptoms he experiences fantastic and is blowing away. He only specializes in explant surgeries. He does also other surgeries, but he does not put like this bags in. He takes them out only because he truly believes in the BII symptoms. That's a plus, plus, plus on my list, and this is the reason why it really helped me narrow it down with no problem. Like I said, do your own research and look at the patient's reviews, and basically your own final choice will be yours. Is at the end of the day, you have to be satisfied and happy and content with the plastic surgeon that you choose. I don't want you to go into somewhere that you may not feel like at ease and you're kind of like, oh, I don't know about him. Always follow your intuition. Always follow your intuition, girls, because this is something that is going to lead you to success in anything you do. So, like I said, I follow my own intuition. You're gonna the end, you're gonna choose your own final choice. The reason why I chose him because he's very, very detail oriented plastic surgeon, which you have to be. But he's the one that basically you face once you are in the consultation, and you just will know right away if he's the right one for you. And he has the most amazing heart. He's the most amazing human. I can go on and go on and go on and sell his practice, but actually I'm not here to promote. Like I said, this is like out of my heart. I want to appreciate for everything he's done for me as far as the surgery. It came out amazing. It's just, I have a whole list for him. He has an amazing gift. I actually did tell him in person. I told him straight out from a healthcare professional to plus to another person that in the medical field. I have told him that, from my heart, I think he has definitely healing hands. He is a very blessed human being. I think I almost either made me cry about telling him how I feel, because I was very, very, very moved by his way of professionalism and the way he presents himself. Beautiful bedside manners. He's hands down the best, and that's the reason why I pick him. One little story I just want to share with you. The reason that I still remember clearly is when I went to the OR. I was given the anesthesia, and right before shutting my eyes, I remember he held my hand and he just gave me this warmth, this feeling that I can't even explain. You just have to be there in order to understand. Even when you meet him in the consultation, you're gonna know by then. But he is just my angel through life, I would say. He's just definitely been there, and I do appreciate him. And yeah, that's the reason why I picked him. Look at this beautiful capsule. Look at these beautiful capsules. Anyways, this is the day Dr. Dev took my um I end up getting a total capsulectomy. I'm gonna go more in detail in another video. This is what the foreign bodies, basically these breast implants come in contact, and your body and your capsules automatically try to form in order to protect you. So this is what they are. So I'm just not going to give you like very detailed what happened every week, but I can tell you a little bit about it. It's just on week 1, I could tell the day after. You hear me? The day after plastic explant surgery is when I looked in the mirror and I could see, oh my gosh, I could see that I had color. Can you believe it? Color, like the rosy cheeks. Can you believe that? I never knew that I was able to get them back. I was looking at myself thinking, oh, nice. um, it's just sad because I pretty much all these years I did not have any type of color in my cheeks or in my face. I was just pale, and I was that like, okay, like I just, oh my goodness, I'm just covering my ass and thinking, what was I thinking? But anyways, that's another video, right? So yeah, that was the first thing I noticed, and also like when I open, like a couple days after, I noticed like opening my hands. I usually used to like have joint pain to the point where I would cry. It was really uncomfortable, but I didn't have any joint pain. Um, week 2, I just, you gotta obviously in every week, I would say until week 5 is when I had like still tightness, and tightness was just kind of lowering it, but it started like tightness and soreness, obviously sensitivity in the surgical sites, which is normal. I was able to move the arms. I would say week 4, I was able to move my arms all the way up. 5, actually better movement. And today is my 6 week, 5 days post-op. I'm feeling fantastica. You understand? Fantastica. I will definitely come and let you know exactly what I was feeling each week. Another video. This is just to kind of give you an idea. And thank you. That's all I want to tell you today. I want to tell you thank you from the bottom of my heart for being part of this community, from being part of this casita, this little house or home sweet home. How you call it? Home sweet home. Can't even speak. Sorry. Home sweet home. This is what kind of channel I want to make. I just want to make a little safety place, I would say, like a place where you can just turn to and say, okay, I want to speak to Sylvie. I want to just kind of share my thoughts and just check in, check in whenever you want. I am here for you. I don't want you to ever feel alone. I battling these dangerous symptoms. Trust me, I've been in your shoes. Remember, I've been in your shoes. I'm on the other side. I've been on the other side as a patient. As a mental health nurse practitioner, I hear you. I hear you, every word. I do understand. These are different ways you can contact me. I literally want to spread all this knowledge. I want to spread all this help. I want to try to spread all the guidance I can possible in all these areas that I have, all these different lines you can contact me in. This is just a phrase. This is just a phrase that I actually came up when I started being a nurse, a registered nurse. And this is something that I left with my patients. I share this with them with all my heart. I try to guide them through their journey of healing, of the recovery process from all these different areas of life. And remember that, you are the creator of your own weather. All right? You are the creator of your own weather. So your homework from this video on the comment section, please write what you think of this phrase. What do you think it means to you? I just want to get into your brains, to beautiful brains. I love brains. That's why I'm in neuro. I love, maybe that's why I'm a nerd. Yeah, I'm a nerd. Sorry, but anyways, I just love the way people think. I just love human beings. I love your thoughts. So if it's possible, please just share like 2 words or something that you may get this may get out of this phrase. I just want to listen to you. I want to learn from you and get your ideas or what you think of it. Anyways, just last tip is to get into this website, plasticsurgery.org. That's where American Society of Plastic Surgeons. Click on find a surgeon, type Deb, for example, or any plastic surgeons that you have in mind. Just place their name. That way you can find more information. Anyways, I did speak a lot and I'm so sorry. Actually, this is the second time I'm recording a video. I think the last one I went over 30 minutes. God. So it's 25 minutes, so I need to cut this out. And I just want to let you know, you're not alone. Woman or male, whoever you are, you're not alone. If anything, you want to discuss something in private, just email me. I will do my best to respond to you as soon as possible. I will always usually check my lines of communication with all my family here, with you, which you are all my family, and I try to treat any of my patients like a family member. All this experience that I've actually been through, I will keep it with me in my heart, and with the help and the thought in my mind that to help whoever I come across, a female patient or anyone that has gone through any type of situation, or especially breast implant illness. So this is something to help the future, and hopefully I make a difference on anybody's health, anybody's life. And once again, thank you. Thank you so much, and have a wonderful day, and I'll talk to you soon.